right, guys, I'm here with Dr. Bryan Rogoff, immediate past president of the Maryland Optometric Association and owner of iExec Consulting. There's been a lot you've seen in your time in the industry and whatnot. What are the practice pitfalls, or excuse me, what are the pitfalls that most optometrists in private practice are encountering? What are the most common ones that you're seeing?
So the first thing, I don't necessarily look at them as pitfalls, more like challenges. And when we go to optometry school, we're not necessarily thinking about where we have the background of business. So we go into practice and we know we want to help patients, and we have the idea of how other practices have done this before. But as times change and scope of care start to change, they want to get into dry eye, they want to invest in more equipment, they want to be able to get into that next level. And so a lot of times they don't have the background of operations, efficiencies, and then they start putting Band-Aids on a lot of different parts of their practice. And all of a sudden, the profitability and revenue, and we like to call customer service or patient relationships, that tends to become a downside of things.
So do you think that's because, does that fall into the fundamental problem that most ODs aren't business people and they're more of this clinician, and if they had that business background and skill, would that be less of a problem? Do you think that's kind of the main diagnosis?
A little bit. We always listen to the experts when we're talking about medical care and general things, what we're supposed to do to be able to treat disease states. But when it comes to expanding our business, we're not going to those same type of experts. Sometimes we're looking to see at other people and the success that they've had and said, I can replicate that doing what I'm doing. But the big thing that I always find is the emotional side that they have to their practice and to their business. And really when it comes down to having a lot of motion into what you start to build, it doesn't lead to business decisions, it leads to emotional decisions. So
how does someone separate making an emotional decision and a business decision? You know, I've heard, wait 3 days, everything will feel a little bit different in your mind. I mean, what kind of, when you're doing consulting or talking with docs who are undergoing those pitfalls, how do you get past an emotional decision? Because it's their baby,
And that's always the challenge. And a little bit on how I consult is a little bit different than some other consultants. So the way I approach everything, especially if I'm going to approach it to a doctor-owned practice, is I start from the clinical side and I work backwards.
Oh, I see.
So I tried to be able to use diplomacy and mediate a situation, starting from the clinical side and have them work backwards on how it would look now on a P&L, and so they can start to see it. If I come down from the business perspective, and I'm talking a lot about operations, I'm talking about a lot of financials and numbers, that's not the language that they understand.
Got it. So you almost have to start from a place that they know, start from a bit of an emotional place, and then pull it backwards.
Yeah.
What about, I think when someone's undergoing this kind of pitfall or the industry's changing, does it all come down to goals? Like, look, doc, you got to focus on really what is your end goal in all this, and remembering why they got into this and how they're trying to provide for their family, or kind of those end results, and how does that affect your process in helping a doc get through a challenge?
I saw where they want to be, and a lot of times it could be something that may not be value to their customer or patient. Sometimes it's a value of what they want to do. And in business, that's not where the value comes from. It comes from the patient and what they want. So a lot of times that might not be what the thought process is. However, if it's a financial goal, we can work with that and say, okay, how are we going to be able to reach X?
Got it.
So it's all about knowing where the value comes from.
What is that list of the most common challenges? I know you kind of briefly listed it before, but give me kind of like the bit more extensive. It's 2018.
Sure.
This year is going to present a whole new set of challenges we haven't seen before. What are the top things, say top 5 things or so most docs are going to encounter as a challenge this year?
I think it's just been an ongoing challenge with some of them. I mean, there's a lot of consolidation in the industry. So it's the partners that you used to work with before to who now are the people you have to work with now. A lot of competition, there's a lot of growth in the market, there's a lot of low barriers to entry where people are starting to come into this market. And not just to mention, the simple things of patient retention, how are you going to retain that patient and how to increase your market share as you start to lose it. So there's a way to bring in new patients, but if you're losing more patients than you're bringing in, then you're always going to be able to start to lose your revenue and your profitability.
Does it come down to bringing in a new modality or doing something that isn't like kind of one of the more commodity pieces of eye care? Whether it's specialty contact lenses or really focus on dry eye, is that often a remedy to some of the challenges?
To some, yes, but that's really to know where your patient base and where the value that the patient really wants to have in practice. If they're not interested in those services, or there's not a demographic where needs those services, then you're going to be investing in money that's not going to show any profitability.
So I guess you've got to look at your target market ultimately, right?
Exactly.
Are there ways to look at your target market? I mean, you just go outside and say, oh, okay, I get, look at your charts. I mean, what's the best way to understand what your patients want and need? Do you survey them?
I always recommend to do a third-party type of survey.
Okay.
And have a third party to be able to do these things. And also, I promote a lot of things like using NPS Net Promoter Scores.
Yeah, sure.
So this way you know who's promoting your practice absolutely loves it and would refer it, because word of mouth, people take that recommendation over 70%, and if it's from friends and family, it's going to be over 80%. I mean, there's stats out there that show word of mouth is king.
Yep.
But the ones that also the detractors is knowing why those people wouldn't promote your practice.
Oh, I see.
And then of course the ones that just are neutral, that's like, they can take it or leave it.
Yep.
But knowing that's a great statistical method that will show you if you're in the right direction of where you should be adding that value for your practice.
So it sounds like you could put together a simple NPS, send it to email for every patient maybe a day after they had their appointment, make it anonymous and get that score and track it over time.
I still would recommend a third party.
Okay, gotcha.
I always recommend third party, so this way you're getting the least biased information and then coming from the office. Because a lot of times we don't know the right questions, or we might lead certain questions to answers that we might want to hear.
Yep.
If we're using a third party service, then they're getting a little bit more validity out of the statistical population that they're surveying.
Got it.